Dr. Dale Edlin, a cardiologist at Bayshore Community Hospital. Dr. Brett Sealove, medical director of Meridian's AngioScreen program. And Dr. Edlin, am I pronouncing it right?
That's right.
And Dr. Edlin, you and I were talking before, and we were talking about what it really takes when it comes to heart health. Women are different from men, and people have to understand that, right?
It's been a very long time since textbooks were written about women by women. I always tell my patients in the office that the textbooks were written by men about men. But we've learned a lot in the last 25 years about women and how women have different sensations, different symptoms, different presentations, and how we have to manage women in heart health and in coronary disease as well.
And we were talking earlier, too, about there are all kinds of testing devices now which didn't exist 20 years ago or even 10 years ago. So the question is, how do you know? I mean, if you're just bopping along, do you suddenly say, oh my gosh, I'm 40, I'm 50, I'm 60, I need a test?
Well, yes, usually you do say, oh my gosh, I turned 40 or 50 or 60.
Yeah, it is scary.
We start with what's called the Framingham risk assessment that you've alluded to already in the show, and it's a very powerful tool to help statistically identify patients or people who should become patients if they have a high risk of developing a heart problem or low risk. And then we amplify that based on particular tests if they're appropriate. So, for example, if someone is a low risk, has no risk factors, is of a healthy weight, and has a normal cholesterol, normal blood pressure, that person isn't going to need to be tested further and should basically go away and come back next year.
And some of the tests, I know we have a lovely audience here, and we have about 1 million people listening at home, and Dr. Brett Sealove, who's medical director of the AngioScreen program for Meridian. Now that's new, and it's considered revolutionary, right? And it's only a 15-minute test, but what is it?
Yeah, sure. It's the premise is it's a innovative, inexpensive, completely non-invasive, no radiation exposure screening test to assess essentially one's cardiovascular health.
How do you do it?
It's actually relatively simple. The test itself, again, takes anywhere between 6 and 10 minutes. The whole process takes all of 15 minutes. And it involves ultrasound, which we take a few snapshots of the carotid artery, which is the main arteries that go to the brain. We do a 5-lead EKG to look for any heart irregular rhythm, predominantly atrial fibrillation. And both of those two entities are a very common cause of stroke. And as we all know, stroke is the third leading cause of death in the United States. It's the number one cause of morbidity and disability in the United States. So it's an incredibly important screening tool for these two common causes of stroke. It also looks for an abdominal aortic aneurysm, which is, again, with ultrasound techniques, looks at the main artery in the belly and in the abdomen, which there are many, many people in the United States that have this expansion or growth of this blood vessel that can rupture or, God forbid, cause their life. So it also screens for that as well.
Now, when you have a test like this, are there any false positives?
Well, it's interesting you ask that. I mean, this is a screening test, and all screening tests are designed to be, again, relatively inexpensive because you're using this in a large population. And the whole purpose is to try to make this as specific as possible. There aren't many false positives. But it is a screening test. Just like everything in life is screening, there are going to be false negatives and false positives. What we try to do with our certified technologists and people that are overseeing this, we have our own kind of Q&A kind of discussion that we do on all of our exams to make this as sensitive and specific as possible to minimize those risks.
And Dr. Dale Edlin, before we let you go, I know you have stressed how important it is to see a physician, not to sort of take yourself for granted, but really be responsible in a way.
Yeah, that's really important because we're trained to be able to do the screening and indicate what, if any, testing is necessary and what is appropriate for each individual patient. For example, if we have someone who's got an intermediate or a risk of having heart disease, they might benefit from a cholesterol drug or an aspirin, but we're not sure. We might do a test called the calcium score on our 64-slice CT.
Hold that, because we're going to take a quick break. I want to ask you about that. And again, sort of the magic pills, the aspirin, the statin. Should everyone over a certain age do that? Let's talk about it next. it's really important. You know, we're not our own doctors, but we do need information. And that's why we're so excited to be partnering with Meridian Health, the great health group throughout the state of New Jersey with major hospitals. We're broadcasting from the Merry Makers at PNC Reception Center in Homedale, New Jersey. So, Dr. Edlin, you were talking about a calcium test. Again, we just heard about another test, non-invasive, not radiation, that could really give you a peek into your future, so to speak.
Right. So the most important thing that we do as physicians is to identify who should have more testing, who doesn't need more testing, and if you do need more testing, what are you going to do? So one of the options that is well-studied technology is called the 64-slice CT. We do a very simple test which has radiation, but the dose is very small, and it, in 15 seconds, a single breath hold can scan the heart and can, with a technique of quantification that was done by Dr. Agatston before he wrote the South Beach Diet, we can measure how much plaque is in the arteries. Now, this is not a test that should be done on everyone, and it's not a test that should be done on high-risk patients or people who are going to be needing to be treated anyway. But in that intermediate group, using this test, you can stratify 50% into a very low-risk group or a very high-risk group.
So calcium plays a part in whether you're high risk or low risk?
Not the calcium level in the blood. This has nothing to do with bones or blood calcium.
No, I know that.
This is the calcifications in your arteries, in your coronary arteries giving blood to the heart. There's more calcification that happens when there's more plaque. Mm-hmm. And the more plaque you have, the higher the risk. And unlike a statistical test like the Framingham, this actually evaluates how much plaque you, as an individual, have in your arteries, which is a much more powerful tool to go forward.
So let's say that you find an excessive, I think it's done numerically, or a certain amount of
Correct.
Plaque in the arteries. Do you try to treat it medically?
Oh, absolutely.
So the first line is
the
medicine.
first line, the second line, and the third line.
Before surgery.
Yeah, absolutely. The idea is that this is a medical disease. The plaque that accumulates in your carotid arteries or in your abdomen
Right.
or in your coronary arteries, it's all a medical issue. It's a question of diet. It's a question of exercise. It's a question of taking an aspirin and a question of being on a statin when it's appropriate.
And are those really magic tools, aspirin and statins? There's been all kinds of new information that aspirin is beneficial to everyone if you don't have stomach problems or...
Well, and that's just the issue. If you were to study a group of women before menopause, the risk of having a stomach upset or a bleed on aspirin is higher than the potential benefit. But if you study a group of patients who have heart disease, the aspirin risk is the same, but now the benefit is much bigger. And the same thing applies to statins. Statins are wonderful drugs. We get a lot of bad press because some people get muscle aches and cramps, but for most people, the benefit outweighs the risk, but only if they have enough problem that they would benefit from the medication.
Okay, and I'm curious, Dr. Brett Sealove, when they take the angioscreen test, which is the one we talked about, the revolutionary new heart and vascular health screening, and you do find problems, is that too corrected medically?
Yeah, I mean, most of the time these people are asymptomatic, meaning the worried well, the people that are concerned about their overall health, and we bring it to their attention. They bring it to their physician. We give them physician names in our network if they don't have one, and it's really designed to prevent disease before it occurs. We are incredibly good, unfortunately or fortunately, of treating acute strokes, acute heart attacks, but it causes a tremendous amount of mortality, morbidity, and obviously health expenditures. So the name of the game, and regardless if you're a blue or red state, the name of the game really is about prevention. It is cost effective, but more importantly, it's about patient health. And these kinds of screening tests absolutely bring one's risks and cardiovascular awareness to the patient and thus to the physician.
And as we're all hearing, how important it is. 2 tests, one with no risk at all of radiation, one with nominal, that could really change the future and your health. Thank you so much, Dr. Dale Edlin, cardiologist at Bayshore Community Hospital. Very important. Dr. Brett Sealove, medical director of the AngioScreen program for Meridian. Appreciate your time, both of you. We'll take a quick break.
Thank you very much.
And we'll be back right after this.